Hi, I'm Dr. Scott Jensen, and I'm running to be the next governor of Minnesota.
And I'm Matt Birk, running to be the next lieutenant governor of Minnesota. You know, Scott, one of the reasons I joined you on this journey is because you are willing to drive and have the difficult conversations. And the whole conversation changed around the life issue when Roe v. Wade was overturned. Now, you and I are both pro-life, but I think there's some misconceptions out there about what that actually means. It means a lot more than just not liking abortion. And it's not about jamming legislation down people's throats. And by the way, whoever the governor is after November 8th, abortion is not going away in Minnesota. I don't know why Tim Walz and Peggy Flanagan keep acting like it will when we're in office. But really what the pro-life movement is about is it is about loving and supporting the child and the mother. It's really about uplifting women and creating a system where abortion is not necessarily illegal, but it's just not needed.
And I think the conversation is complicated. It's complicated by the fact that I'm a physician. I mean, you and I are both fathers, we're husbands, we've had blessings galore. But there are times when I might speak to a political issue, and I could do a better job if I put my doctor hat aside. As a physician, I always look at two lives, and I always elevate the pregnant woman's life right in front of me. But as we have this conversation, it's really critical to understand that I don't necessarily immediately get where other people are at. And you're right, this is about so much more than, quote, being against abortion. I want women to be supported and protected. As a father, I saw my daughters at times struggle with the fact that their life wasn't quite the same as my son's. So this has been a great conversation, and I'm pleased we had it. I'm confident that we'll probably say a word or two during our video here that someone will criticize us for. But I think we should just jump in. We decided, at your recommendation, that we should do a 10-point program to support and protect women.
Absolutely.
Let me jump into it. First off, we need to propose a family and maternity leave program to assist parents to spend time with their children. We need to hold businesses harmless in regards to the cost of that. We need to provide for an adoption tax credit of at least $2,500 per adopted child.
You know, Scott, two of my kids are adopted. We often forget adoption as sort of the third option in this equation. If a woman's unexpectedly pregnant, it's either abortion or you're sentenced to single motherhood. Adoption is a beautiful thing, and there are thousands and thousands of families in Minnesota who are more than willing and desperately want to adopt a child.
And in keeping with that line of thought, that's why we need to dedicate a division of employees from DHS, the Department of Human Services, to screen, process, and expedite adoptions to reduce costs for adopted families. We need to increase funding for crisis pregnancy centers to assist with counseling and support for pregnant women. I see patients all the time, and they are absolutely stretched to the nth degree of their nerves. They're saying, what do I do? They need to be able to talk to someone.
And crisis pregnancy centers are not the evil places that Senator Elizabeth Warren made them out to be. They actually support women emotionally, financially, medically, and actually enable women to really make that choice if they do want to keep that child.
And in keeping with that, we need to make certain that we're there for the pregnant woman before, during, and after. And I think that that's one of the reasons why we need to make sure that Minnesota's child care programs allow for more slots, that we reduce the regulations, and we try to unleash the profession of daycare. Government has done a lousy job of supporting daycare providers. I think we also need to enact legislation to provide free counseling for rape, incest survivors, impose harsher penalties for rapists. We should require prompt rape kit analysis, and that hasn't been done. When I was in the Senate, that was a huge issue. But we also need to distribute emergency medication to all patients undergoing evaluations for rape or incest. We want those folks to feel like they're in control of their own destiny. We're wired that way. We need to improve access and availability to birth control by expanding information on natural family planning, providing oral contraceptives over the counter with ceiling price structures, and we need to remove barriers to ongoing family planning needs. I remember when I first went into medicine, Matt, you couldn't get a renewal for your birth control pills unless you came in and got your annual pap smear and your physical exam. And by the time it was all done and said, you might have spent several $100s and nothing had changed in your health. Things are starting to change there. We need to make certain that women feel in control of their own situation and that they don't have to spend $300 to $500 every year for that. And I think the American Medical Association has come out and said birth control pills should be over the counter. I'm absolutely in support of that. I think we also need to enact legislation that requires parental notification for minors undergoing abortions. I think the recent decision by the Ramsey Court judge was a huge mistake. These were bipartisan protections. We had parental notification. We had a strong requirement for informed consent. Maybe informed consent seems difficult for people, but at the end of the day, informed consent is simply providing the information that allows someone to really provide voluntary consent. Informed consent has to be held up as one of those key values in healthcare, in every aspect. And I think we also absolutely need to identify what is an appropriate venue, who is an appropriate provider for whatever medical service we're talking about. And I think the Ramsey Court judge undercut that, so we need to put that back in place. And I suspect there will be bipartisan support for that. I think we also need to propose and pass harsher laws for crimes that are proven to target women. Women are targeted for robberies, carjackings. I don't think we need to beat around the bush on this one. Quite frankly, this is a real problem. I have 60, 70, and 80-year-old women looking around the parking lot before they open their car door. This is crazy. We need to create a commission dedicated to addressing and eliminating child pornography, human trafficking, and sex trafficking. Matt, I know you and I both feel we got to bring the hammer down on this.
This is an underreported crime, and unfortunately, Minnesota is somewhat of a hub for this disgusting, evil behavior, and it needs to be made a priority, and you and I will make it a priority.
Yeah. And if I've been clumsy on some of my communications regarding my pro-life position, I would just say this. I never thought it necessary to try to identify what those exceptions might be in regards to legal abortion or not. Because I always thought that when I uphold the pregnant woman's life, and if her mental or physical health is in danger or jeopardized, that's all that needed to be said. But I understand that my words maybe were more doctorish, and maybe they need to be different. So I'm just going to say it real clearly. Without question, rape and incest are exceptions that, with no hesitation on my part, I would want a pregnant woman to feel that they absolutely have the choice in that. You cannot bring a tubal pregnancy to fruition. What you would do is you would sacrifice the pregnant woman's life, and as a physician, I would never go along with that. So I think if I've been unclear previously, I want to be clear now. Rape and incest, along with endangering the mother's mental or physical health, are acceptable exceptions. I think that the life of the mother extends so far beyond just the delivery. And I know, Matt, you've really had a heart for that. And so I'd love you to go ahead and just speak to that issue, that we want to be so much more than maybe the conversation has allowed. Because after the delivery of that child, I think that the Republicans at times have been accused that we haven't really been there. And you and I are going to change that.
Oh, absolutely. I mean, that's what, that's why you look. We have 87 crisis pregnancy centers in Minnesota, and all of them are doing that work, supporting women afterwards with, whether it be diapers, clothes, cribs, job training, job placement. And that's what I mean. The pro-life movement is about so much more than just being against abortion. It is about loving women, loving mothers, loving that child, and trying to make it so both of them can have a great life. You know what? Not all my kids were expected pregnancies, and I know our situation is different, but thank God they weren't. And we want to make that available to all women. So I guess so they don't feel like that, and somehow that they don't have a choice and that they have to have an abortion. Because deep down, I don't think women are like really want to have abortions. They do it because of other circumstances, and they feel like they don't have a choice or a way out.
Family planning is tough work. I remember Mary and I, we had 3 different miscarriages. We desperately wanted a family. We thought that we'd have a bigger family than we were able to. And we don't have all the answers, but we really wanted to have a conversation. And this 10-point program bubbled up really from the conversations we had with Minnesotans all over the state, men and women, grandmas and grandpas, young people. If in the conversation that we're having even today, we've said something that offends, that's certainly not our intention. We just really think that as elected leaders, we have got to be willing to dive into those areas that are fraught with political danger. But I do resent the fact that I think Governor Walz has been willing to make this so political. I know that the MCCL has come out and they've said this very clearly, and I think it's worth sharing. They said this. In May of 2022, Governor Walz called on Congress to pass a sweeping bill enshrining abortion until birth in federal law and eliminating almost all existing protections for unborn children across the country, including Minnesota's parental notification and informed consent laws. I'm a father, you're a father. I don't know what the exact statistics are, but the great majority of parents believe that they should be notified if their minor daughter is having an abortion. I know that if I as a father were awakened to a crisis in the middle of the night because my daughter was bleeding from a procedure I wasn't aware she had, that would cripple me as a father. So I'm hoping, Matt, that Minnesotans can join in the spirit of this conversation. We are absolutely convinced and certain that Roe v. Wade being overturned pushed this conversation back to the states. And for Minnesota, it's not on the ballot in November. We have Doe v. Gomez in 1995 assuring the opportunity and the access to an abortion, and that can only really be changed through a constitutional amendment, which has way outside the, if you will, the purview of the governor. So I don't think the conversation ends here. This is just the beginning. I think, Matt, you and I have been courageous. Perhaps at times we could have done better. I'll own that. But as I go forward, I know I'm going to keep on listening. And I think that for me, a big part of the reason that you and I are so convicted about the path we're on in this race to be governor and lieutenant governor is because what is on the ballot in November is an economy that's absolutely tanking, that inflation at 9.1% is outstripping the wage earner who's making a 4 to 5% raise this year, which is one of the biggest raises they've had. And that public safety is no longer anything that someone can assume. And we're saying our children should be educated in an ABC kind of manner. We're talking about a foundational education. We're not talking about giving someone the opportunity to indoctrinate them into some political perspective. That's why we're doing this together, Matt, and I'm darn proud to be running with you.
I'm proud to be running with you, Scott. And I'm proud of our plan, too. I think this is a good plan. I think this is us putting our money where our mouth is when we talk about uplifting and honoring women and mothers. It'll probably change a little bit. I think we'll get a lot of feedback, and we're going to keep talking to people about it. But I know this. Just making abortion legal and making it legal up till birth, taxpayer funded, that is not honoring and loving and protecting women. To me, that's just a political game.
And I don't think it's unreasonable for us to ask Tim Walz and Peggy Flanagan, where do you draw the line? Where do you stop? Because quite frankly, I think there's something like 75% of Minnesotans don't believe that people should be electively choosing abortion at 39 weeks. You and I don't have to settle where is that line. What we know is that abortion in Minnesota with Doe v. Gomez is not on the ballot in November. It's an assured right, and we have no intention of going to battle on that. We want to govern Minnesota. Thank you.